Anemia in SLE is, anemia in SLA. What is SLA? Systemic lupus erythematosus. So whenever you come across SLA, every student will go for type 3. But the answer is type 2. I will explain. In SLE, what happens is there is formation of antibody. There is formation of antibody. And what is the antigen? It is your double-stranded DNA. So your double-stranded DNA binds with the antibody and you come across antigen-antibody complex. This antigen-antibody complex will be depositing in all parts of the body. In all parts of the body. So this all parts of the body, there will be deposition. So you come across multi-organ involvement. And any hypersensitivity which deals with immune complex mechanism is type 3. So the multi-organ involvement seen in SLE is because of immune complex deposition. So this is a type 3 hypersensitivity. But what happens in anemia? In anemia, what happens in SLE is the antigen will be sitting on the surface of the RBC to which the autoantibody binds, and this will be destroyed. Means the antigen is fixed on the surface of the RBC. So the antigen is fixed on the surface of RBC to which antibody is binding, and this is destroying. So whenever there is antigen which is fixed on a surface, so this comes under type 2 hypersensitivity. So what was asked in the question is, what is the hypersensitivity seen in anemia in SLE? It is type 2. If it is a multi-organ involvement or lupus nephritis seen in SLE is which type of hypersensitivity? Then answer should be type 3. Is it clear? And another simple logic is anything related to RBCs always comes under type 2 hypersensitivity, because type 2 hypersensitivity, the antigen will be fixed on the surface of the cell or tissue. In third hypersensitivity reaction, antigen is free, antibody is free, both will deposit and cause immune destruction. Is it clear? What is the difference between type 2 and type 3? Type 2 antigen is fixed, type 3 antigen, antibody, both are freely circulating in the body and gets deposited and cause immune destruction. So anemia in SLE is a type of type 2 hypersensitivity. Only SLE or systemic manifestations of SLE comes under type 3 hypersensitivity.